So now we're going to move on to babesia. Babesia is actually a high yield subject for USMLE Step 1, and probably the biggest reason is because it causes co-infections with Lyme disease. So you'll see that it's transmitted by the Ixodes tick, which also transmits Lyme disease. So it causes co-infections with Borrelia. So here's the vignette for you for babesia. You have a patient that comes in, presents with flu-like illness and a bullseye rash. You get the diagnosis of Lyme disease. You prescribe doxycycline. The patient goes home, but he's not getting any better. And now he's starting to complain of these malarial-like symptoms. That is going to be a sample vignette that they can ask you about babesia, because the drug of choice and the treatment for Lyme disease is not going to cover the treatment for babesia. So babesiosis is a malarial-like illness in co-infections, again, with Lyme disease. And the diagnosis I'm showing here, you can see a red cell that I'm circling that has this cross formation. So this image they could very easily show you, or they might mention the formation of a Maltese cross or a tetrad in infected red blood cells. All right, so that is diagnostic for babesia. The treatment that will cover babesia is clindamycin and quinine. So the original doxycycline that the patient got for treatment of Lyme disease is not going to cover babesiosis. So that'd be a typical and easy way that they could ask you about babesia. They may not ask you how to diagnose it. They may say, what would you find in the infected red cells? And in that case, you'd have to know it's the tetrad or the Maltese cross. All right, the next organism that you have in your table is Toxoplasma gondii. This is also a high-yield organism for Step 1 of the USMLE for a couple of different reasons. Number one, it causes illness in AIDS patients, and number two, it crosses the placenta. So for those two reasons, it's high yield for Step 1. Cats are the definitive host, so we've all heard that, you know, when you're pregnant, you're not supposed to change the cat litter. This is great, ladies. It gets us out of one chore at least that we don't have to do anymore, changing the cat litter. But also in the U.S., pork is actually the most common vector of toxoplasmosis. Now, we're going to go through some diseases in healthy individuals, then in pregnant individuals, and then in AIDS patients. All right? So in healthy individuals, toxoplasma can be on your differential for mononucleosis because you're going to get a flu-like illness with lymphadenopathy, fever, and it resembles mononucleosis. It would be one of the organisms on your differential for heterophile negative mononucleosis. Okay, so that's in healthy individuals. Let's look at pregnant patients. Women who acquire toxoplasma as a primary infection during pregnancy risk it crossing the placenta. And they can get, again, a flu-like illness. We might call it heterophile negative mononucleosis. And if it's a primary infection that she acquires during pregnancy, the fetus can be infected. Now, again, with congenital infections, we know we've got this wide range of symptoms from asymptomatic to stillbirth and everywhere in between. But a couple of things that really stand out for toxoplasmosis are hydrocephaly, which I'm showing you in this image, and actually progressive blindness, okay? So if toxo crosses the placenta, the fetus can be born looking asymptomatic, okay? And all of a sudden in the late teens, early 20s, they start to lose their eyesight, and that's irreversible. So if you come across a question like that where somebody's losing their eyesight a little bit later in life, not necessarily as a child, and they want to know what congenital infection it is, and it's going to be toxoplasmosis. Now, if the mother is exposed to toxoplasma a second time, if it's a reinfection or a secondary infection, the IgG that she's made is going to cross the placenta and it's going to be able to protect the fetus. So the last situation I want to talk about with toxoplasma is an AIDS patient. This is the leading cause of CNS disease in AIDS patients. So the typical vignette is going to be that you have an AIDS patient coming in, they've got kind of these chronic headaches, and typically they'll order a scan, a brain scan, and as I'm showing in the image here, one of the buzzwords you're going to have to know are ring-enhancing lesions. So the brain scan, if they show it to you, if they show you the image, you'll have to be able to identify the ring-enhancing lesions. Or if they mention the ring-enhancing lesions, you want to be able to associate that with toxoplasma. All right? So leading cause of focal CNS disease in AIDS patients usually causes an encephalitis, and we're going to go with the ring-enhancing lesions. Now, unless you prophylax AIDS patients who are seropositive for toxoplasma, they're going to have recurrent and reactivational infections with toxoplasma. Now, diagnosis for toxoplasma is serology. And remember, in the case of the pregnant female, if she were to come in and with this flu-like illness and you were to find IgM specific for toxoplasma, you would know then that she is having a primary infection with toxo and the fetus is at risk. Okay? On the flip side though, if you were to look at her titers of antibodies and you were to see IgG, you would know that this is a repeat or secondary infection, and the fetus would be protected because the IgG can cross the placenta. All right. The treatment for toxoplasma, pyrimethamine, and sulfatazine are used as the drugs of choice, and again, unless you prophylax AIDS patients, they're going to have recurrent and reactivational infections. So Babesia and toxoplasma, both in that table, are both considered high yield for step 1.